Hello and welcome to The Signal, WorkplaceNL's health and safety podcast. WorkplaceNL is the Workers' Compensation Board in Newfoundland and Labrador, Canada. The focus is to promote safe and healthy workplaces, provide return-to-work programs, and offer compensation to injured workers and their dependents. This series of podcasts will provide you with the latest information on how workplaces can protect the health and safety of workers. Please enjoy the show.
My name is DeeAnne Feltham-Scott. I am joined today by Marta Evstigneev, the Coordinator of Education with the Canadian Hard of Hearing Association of Newfoundland and Labrador, and Erin Jones. Erin is an industrial hygienist here at WorkplaceNL. We are going to talk about hearing health as well as hearing loss and explain the contributing factors to hearing loss. And Erin is going to outline the elements of a hearing conservation program in taking action to protect workers' hearing health. So welcome, Marta and Erin. Thank you so much for being a part of this episode.
Thanks for inviting me.
Thanks, DeeAnne.
So happy that you're both here. So Marta, let's just begin with you. And can you give us an explanation of hearing loss?
Yes. Pretty simple concept, you would think, but sometimes people don't understand it fully. So we speak of hearing loss when somebody can't hear sounds as fully or as clearly as they should, right? Simple enough. So hearing loss can range from mild hearing loss, where you might struggle hearing voices or speech in noise at a distance and so on, to profound, where we speak of medical deafness, right? And it can be present from birth. So some people have genetic conditions and are born with it, or it can have other causes and happen with age. All of us eventually, the hearing goes with age, but the biggest threat, and actually that's how hearing loss due to aging happens as well, is noise exposure. It's just all the noise we're exposed to in our life, throughout our life, eventually takes toll and damages our inner ear, and that's how hearing loss happens, right? And the thing I want to emphasize that hearing loss is not just about volume. People think it's like a volume dial on your radio, right? The stronger your hearing loss is, the quieter the sounds are that you hear. But it's not always the case. It is just as much, or maybe even more so, about the clarity. So people with hearing loss can hear sounds and they say, I'm not deaf, I can hear. And they can hear people talking, but they can't understand what people are saying. And that makes it really hard for people to realize they do have hearing loss. So that is something I like to kind of underline and put an emphasis on.
Yeah, I really like that analogy about the volume on a radio.
Yes, exactly. So that's a misconception.
Yeah. So you talked about, of course, as we age, we do have some degree of hearing loss, and noise-induced hearing loss is probably one of the main factors to hearing loss. So what are some common signs that somebody is experiencing some hearing loss?
So hearing loss is often very subtle, and it happens gradually unless it's due to head trauma or some, disease or something like this. Usually, in most cases, it happens very gradually, and it's really hard to detect, actually. We are speaking of invisible disability because other people don't know you have hearing loss, but also people themselves don't know. In fact, usually people have hearing loss for 7 to 10 years before they find out about it and do anything about it. Almost 80% of people with hearing loss don't know they have hearing loss. So what usually happens, it's people around you that notice some signs, some red flags before you do yourself. And some things, of course, are pretty obvious, like putting your radio or your TV up on blast and people are saying, oh my God, it's so loud. Let's dial it down. Why do you need to have it on 100? But also, people ask others to repeat themselves. They mishear questions. They a lot of the time complain that people are mumbling, so they put the blame on the others and saying, oh, I can hear just fine. It's just they need to speak up and speak clearly. People with hearing loss almost always struggle in noise. So when there is a noisy environment, like in a restaurant or, outside by the busy street, it's really, really hard to hear, especially speech sounds. Missing some sounds. For example, specific sounds, a lot of people have high pitch, high frequency hearing loss. So they're missing really loud sounds that are high pitched, like fire alarms. And those things are loud. But if you don't have that register available to you, people can't hear fire alarms. Yeah, so we actually have a program where we provide hearing accessible fire alarms to people. It's called Alert and Aware because of that issue, right? Because it is a real safety concern. People sometimes bluff, which means they answer questions inappropriately. You ask one thing and you get a completely out of the pocket answer that doesn't fit what you ask, because you can only ask so many times for somebody to repeat themselves before you say, well, enough's enough, right? So people just bluff and say, I'll just try and get out of this conversation. Yeah. So those are some signs. And as you can see, a lot of those would be more noticeable to people around you.
So it must be really frustrating for the person who has hearing loss, but as well as the individuals that they live with, that they work with. I mean, it can certainly impact somebody's mental health, the person who is experiencing the hearing loss themselves. So besides the health effects of the hearing loss itself and the effects on a person's mental health, are there any other health effects that a person might experience?
Most significant risks that we try and tell people about, and it is actually not very obvious, is the effect on your cognitive functioning. Hearing loss is actually a number one risk factor for dementia and cognitive decline.
I did not know that.
Yes, neither did I. We actually collaborate with a MUN research group that does research on aging and cognition, and that's where I found out about it. It is a number one risk factor. I'll say it again because it's scary. And I'm sure nobody wants to lose their mind, literally, right? With age, this is one of the biggest concerns people have, aging. Nobody wants to have dementia, So protecting your hearing protects you from it. Even mild hearing loss over time, if left untreated, doubles your risk for developing dementia. And the higher the level of hearing loss you have, the higher your risk is. Mental health, like you mentioned, is another big one, and it comes from inability to communicate effectively with those around you. When you're always solving a puzzle, trying to fill those gaps that you're missing in the conversation, bluffing your way through, it is an uncomfortable situation to be put in. But then also people misinterpret it. Sometimes you can't hear, but your husband or your children, they think that you're just not paying attention. It's selective hearing, miscommunication happens, and so on. So it does affect your mental health. And also social situations, like I said, when there are multiple people around, everybody speaks at the same time. There is noise because a lot of social gatherings are noisy, right? It is very stressful and very difficult. People get exhausted just trying to keep up, trying to understand what's going on, trying to have that conversation. Eventually they say, this is not worth it. I want to avoid those situations. I don't want to put myself in them. And they get isolated because they don't, they can't tolerate the gatherings. They can't tolerate being around people. And that has its toll on the mental health, right? So cognitive and mental health effects are very real. And of course, we all know now, there's more awareness that mental health affects your physical health. But hearing loss has direct ties to other conditions. There is paradoxically a higher risk of cardiovascular problems and high blood pressure, which you wouldn't think. How is that connected? Your ears, what you hear, to your heart health. But it is. Balance issues, that is a little bit easier to understand because balance also happens in your inner ear. So hearing and balance are connected, and people with hearing loss have much higher risk of falls and injury associated with it. And especially with noise-induced hearing loss, but also other types, tinnitus is also a big factor. Tinnitus, sometimes it's pronounced both ways, and both ways are correct. So tinnitus or tinnitus is when you hear a sound that doesn't have an external source. So it's a phantom sound in your head and you can't get away from it. And some people are not really bothered by it. It's very common, actually. But some people, it really affects them to the point where they can't handle it. It is really difficult to come to terms with. And, when it's related to noise-induced hearing loss, it is totally preventable. But once it happens, it is very hard or impossible to treat and cure. So a lot of health effects that you wouldn't think, hearing loss would have. We do want to bring that awareness so people protect their hearing, because you're not just protecting your hearing,
Absolutely.
You're protecting your overall health.
And I guess, as you were saying as well, early treatment is key.
Absolutely, yeah.
To preventing or slowing down the onset of the other physical and mental health effects associated with hearing loss.
Absolutely. So we could have a whole podcast episode just on hearing aids and expectations and how they work and all that. It is not a simple piece of technology, and it's not people have an expectation of hearing aids being like glasses. You put them on and your vision is 20/20. That's not, unfortunately, how it works. But research shows that a lot of those health effects that hearing loss has get mitigated, minimized, or even eliminated when you treat the hearing loss. So not only do hearing aids and other equipment helps you hear, but it helps your overall health as well.
Yes. So it makes absolute sense to catch this and, I guess, nip it in the bud.
Definitely.
For the person, for the family, for the workplace, for the community, it makes such great sense to do that. So another reason why we're here today, of course, is to talk more about noise-induced hearing loss and measures that employers can take to prevent hearing loss that's associated with the work environment. So noise is a common hazard found in many different work environments here in Newfoundland and Labrador. Noise really becomes that occupational health hazard when the sound is loud enough and the worker is exposed long and often enough to create a risk for developing hearing loss. And we know as well that occupational health and safety legislation, our provincial legislation, requires a hearing conservation program when there is overexposure to loud noises in the workplace. So Erin, we'll move on to you now. So what creates noise in the workplace and the work environment?
Yeah, as well said there, in your introduction there. When it comes to the workplace, it depends on the type of work being done. You say in an office, it could be just like chatter. Sometimes that's not necessarily harmful. It could be more of a nuisance. But if you think about like manufacturing, construction, things like that, if you think of a fishing boat, for example, on a fishing boat, you've got an engine room. So you get the constant hum or noise being emitted from an engine. There's pumps running, different hydraulic sources. You also have a different type of noise you're being exposed to, which is impact noise or impulsive noise. So that's the result of two solid objects colliding or maybe an explosion. So a good example, if someone routinely fires off like a firearm, you could be exposed to impact or impulsive noise that way. Or like you say, use a boat again, loading cargo to and from the boat. You got metal containers hitting the metal deck on the ship. You get that loud ringing sound. So those are your main different types of sources of noise in the workplace too. And we do have safe levels for exposure to those different sources of sound. In Newfoundland and Labrador, we reference the American Conference of Governmental Industrial Hygienists, TLV book. So in that book, we got two different levels of noise we can be exposed to. So over an 8-hour work shift, you can be exposed to 85 decibels. That's your average over the whole work shift. And at any point, if you're exceeded 140 decibels, impact noise, we need to put in mitigation procedures for noise as well. Now, important thing to know too when we're talking about noise in the workplace is the dose of the noise you get over your workplace. So it might not necessarily be that constant hum. It could be, you could spend, like say, we use a boat again as an example. You can spend probably like 2 or 3 hours in the engine room. You're getting exposed to continuous noise there. Maybe do some work then up on the deck. You're getting all kinds of impact and continuous noise. So it's all those noise sources combined over your 8-hour work shift. Another thing to note too, oftentimes workers work past 8 hours or more than 40 hours a week. So we need to correct those TLVs for that exposure. With respect to the 8-hour TLV of 85, if you think about a 12-hour work shift, that gets lowered to 83 decibels because you got less time than after your work shift before your next one starts to recover from the exposure. An important thing to know too, when we're talking about decibels, decibels are a logarithmic scale. So, like you say, if we think that, we only drop 2 decibels for 4 more hours work, we're actually reducing exposure by 100 times because each decibel is 10 times the intensity from your reference point. So, like you say, difference between 85 and 86 is 10 times intensity. Difference between 85 and 87 would be 100, and etc.
Wow.
The way I explain it to people is what matters is not only how loud the noise is, but how much time you spend in it. Depending on how loud the noise is, you can only spend that much time. As Aaron just said, at 85 decibel, you can safely spend 8 hours there without hearing protection. But if you up that number by just 3 decibels, so at 88 decibel, your time is halved. So every 3 decibel, which doesn't seem like a lot, and people wouldn't think that, right? But every 3 decibel halves the time that you can safely spend in that environment. It is pretty profound. Absolutely. It is important to protect your hearing.
And is there a particular sound that is more harmful to a person's hearing?
Generally, so when we're talking about like noise exposure, once you get, like say, a broad spectrum of elevated noise, the frequencies that are associated with speech, they actually get amplified because of the shape of our outer ear. So that's like why I say later in life, you get that amplified exposure to those frequencies, and that's the part of your speech that disappears. So like Marta talked about earlier, like the clarity and stuff, as you get older, later in life, after this exposure, those frequencies are harder for your brain to perceive because they get amplified and cause further damage throughout your hearing system.
Aaron, what is the best way for an employer to prevent overexposure to noise?
That's a good question, DeeAnne. Like you say, the best thing to do is to do a proper hazard assessment of your workplace. So that could be as simple as, if you're in a OHS committee or a supervisor, something like that, you could do a walkthrough of a facility. Usually I tell people, if you find yourself, you got to lean in 1 to 2 feet away from someone and kind of elevate your voice, yell to get your point across. Rule of thumb, that's usually around 90 decibels, the average person yell. So if you find yourself having to do that, or you see workers doing that, that's a good indication that noise testing is required. Your own personal experience as you're walking through the workplace, you might hear frequencies that are a bit concerning. You might find it loud yourself, but it's important too to involve the workers. If workers are, on a production line or something like that, if you just have a little chat with them, do you find it loud here? Things like that is very important to get the workers' input as well when we're talking about the workplace, right?
I'm really glad that you brought that up. Worker consultation is key. I mean, they are the ones who are in the work environment, and it's so important to get their feedback and to understand what their issues are. Because in all likelihood, the person who is putting together that hearing conservation program is not on, I'm going to call it, the shop floor. So that worker consultation is key. Occupational health and safety legislation does require a hearing conservation program. What are the elements of this program?
And like you say, if you, following the hazard assessment of your workplace, you determine, noise is probably a hazard there. First thing to do is get a proper noise assessment done. So usually recommend using a third party for that. If you've got a competent individual in the organization, they can do it themselves as well. But following the results of that now, depending on the noise levels you're dealing with, if you're above the 85 or you experience a 140 peak at any point during the shift, legislation requires that you have a hearing conservation plan in place. With respect to the contents of that plan, there is a CSA standard, 1007, that you can follow. We recommend most organizations adhere to that one because it gives you clearly outlines what you need within it. So some good examples would be, like you need roles and responsibilities of like supervisors, the employer, the workers, how the hazard assessment was carried out, what areas of the facility actually feature elevated noise, mitigation procedures, so like engineering controls, administrative controls, PPE. If you prescribe PPE, like earmuffs or earplugs, proper ways of donning them, proper selection, using proper rating systems, things like that. And you also want to consider worker training as well. So it doesn't have to be like a nationwide training program or anything like that. It could be something simple as like a toolbox talk. So once, maybe twice a year with the crew, just review how you don your hearing protective devices, overview what areas of the facility, what work processes you're doing are creating noise, just to reinforce it through the workforce. And another thing to do too is within your training is to emphasize your situational awareness. A lot of times when you do have to wear hearing protective devices, that sense is lowered. So for example, if you work in like a warehouse and there's forklifts driving around, you might want to put extra controls in, like, say, a safe pedestrian walkway. Procedure in the area would be to stay within, the yellow lines. And forklifts never go over the yellow lines. Pedestrians never go over those lines, right? So you create a boundary there so no accidental contact or something happens, right?
And hearing tests are also a part of the hearing conservation program.
Yes, that's right, DeeAnne. Yeah, like you say, part of the legislation too, anytime workers are exposed to these elevated noise levels, within 3 months of hire, they need to undergo audiometric testing, and then annually thereafter, for every year, they're employed in those loud noise environments, right? And another thing to note too is record keeping of those documents is very important too. So like you say, if you adhere to that CSA standard, it's got very clear definitions on all those things, so like record retention times, guidance on hearing protection, selection, things like that as well.
Right. So in your answer, you talked a little bit about engineering controls, isolation, PPE. So we know that PPE is something that a worker will wear to protect themselves from that hazard. So when are hearing protection devices required?
Like you say, following, the best course of action, if we can eliminate the noise, is the best. Sometimes we might be able to substitute something, like talking about a boat again. If there's a noisy pump, can we replace that pump, put a modern one in that's quieter, reduce the noise? Engineering controls, we could install some kind of barrier between us and the noise source. A common thing you might be familiar with, like in an arena. A lot of times if you look up in the rafters, you'll see like matting that's hanging down. A lot of times that's for reverberation, for sound control, but you can use that technique as well to lower ambient noise levels. Another thing we can do too is like administrative controls. So something like we're doing here today, having a discussion, education sessions, training like that. Worker changeout. So instead of having a worker, work in a noisy environment for 8 hours, we can cut it in half to 4. Like Marta was saying there earlier, reduce your exposure to those higher levels. And then like you say, once we got all those things in place, our last line of defense then is our PPE. So that should be our last resort, right? So once you've follow that procedure, your hierarchy of controls, that will be the point at which, if you're still elevated after all that, we will implement hearing protection then.
Right. I mean, because as we know, with PPE, if you've done nothing with controlling the hazard at the source, if that PPE fails, if it's not used correctly, and that person has full-on exposure then to that hazard. Well, we did cover a lot of information, a lot of good information in today's episode. So thank you so much for joining us here today to give us lots of really good information on hearing loss. And thank you to Erin for being here as well.
Thank you for having us, and I hope it's not the last time.
Yeah, thanks for having us, DeeAnne.
Thank you for joining us today. Transcripts are available to use in your workplace to increase workers' knowledge in various occupational health and safety topics. Visit WorkplaceNL.ca for more information on the services we provide to workplaces. Feel free to share the signal on social media to improve workplace health and safety everywhere. Thank you, and have a safe and healthy day.